Hi everyone, my name is Neil Ray, and I'm an emergency medicine resident at the University of Pennsylvania. Today, I'll be speaking about our project in the emergency department regarding emergency department patients' opinions on advanced care planning documents. This work was done alongside Elizabeth Albert, a fourth-year medical student, Francis Shofer, our statistician, and Joshua Glick, our principal investigator. Before we get too far into our project, I wanted to touch briefly about advanced care planning. Advanced care planning, or ACP, is a term used to describe anticipatory documents that highlight a patient's healthcare preferences. There's many documents that exist, but most of the research pertains to this one, the Physician Orders for Life-Sustaining Treatment, or POLST form. While there's a lot of research surrounding this form, it has actually been shown to be difficult to interpret by both patients as well as providers, and other studies have shown that this document is often discordant with patient stated healthcare preferences. So prior to our study, we created a new document, known as the RCare Wishes document. This is based off the RCare Wishes website, which is a website developed by the Penn Department of Palliative Medicine and utilizes a series of ACP modules that utilize less medical jargon and focuses on patient-centered outcomes. Here's the document that we developed. It uses patient-centered language and design to capture individuals' preferences regarding medical decision-making, organ donation, care goals, quality of life, and life-prolonging medical treatment. So what we wanted to do was essentially assess ED patients' opinions of these two documents. Is RCare Wishes a better way of capturing healthcare wishes compared to the POLST form? So what we did was we basically got a convenient sample of patients 70 years or older, and they were approached during the ED visit at two large academic urban emergency departments. They were asked for their opinions on both the POLST form as well as the RCare Wishes document. Patients with cognitive or language barriers were excluded, and we alternated which form was handed to the patients first, and they were then asked to fill out Likert scales to assess the reported ease of understanding, accuracy in expressing healthcare preferences, and comfort in using both of the documents. Here are some of the results. Responses were collected from 147 patients. The average age was 75.5 years, and 51% of them were male. Patients reported, by and large, that the RCare Wishes document was more accurate, easier to understand, and much more comfortable to use, and those were all statistically significant. When we asked them to compare the documents head-to-head, patients preferred the RCare Wishes to the POLST form with regards to accuracy in expressing healthcare wishes, ease of understanding, and felt that it was more likely to promote a conversation with their outpatient provider. Age, gender, race, and end organ failure did not affect these patient preferences. There were some limitations to this study, though. Limitations of the current study include the use of a convenience sample, and the study findings might not be generalizable to patients that are not elderly or an urban academic emergency department. We also use Likert scales, and collecting qualitative feedback about patient preferences would be useful if we were to continue using this document in a clinical setting. So in conclusion, and consistent with prior research, the POLST form appears to be difficult to understand and uncomfortable for patients to use. An alternative document that we made focuses more on patient-centered outcomes. It appears to be easier to understand and use, and is more reflective of the underlying health wishes within this population, which is elderly emergency department patients. Use of this document in other settings, particularly outpatient environments, should be evaluated to determine broader applicability. Thank you very much for your time and for allowing me to speak. I really appreciate the opportunity. Please email me if you have any questions. Thank you.